Do you feel exhausted during the day because you're having trouble sleeping at night? Do you have a thicker cushion around the middle than you really wish was there, but you can't get it to budge no matter what? And are you in chronic pain that maybe interferes with your sleep patterns? If you answered yes to 2 out of 3 of those questions, then today's video is exactly what you've been looking for. But before we dive in, make sure that you've hit the subscribe button and the notification bell. You need a Gmail account to sign into YouTube in order to become a subscriber. And it is the lifeblood for YouTubers like me. And it helps me know that I'm on the right track and that you're enjoying my content. Before we dive into today's content, I'm Dr. Brandy Rose Lipscomb, and I see patients here at Essential Wellness in Arlington, Washington, 4 days a week. And I run an online program for individuals in chronic pain who are looking for a non-pharmaceutical, non-surgical, non-invasive way to heal their bodies from home faster than they ever thought possible. And today I'm actually going to show you one of the techniques that my clients use that across the board they say is their favorite technique right before they go to bed at night, because one of the side effects is that it helps them sleep better. Some have said that their restless leg syndrome has gone away, and others have said that it's the best sleep they've had in over 20 years. So I'm excited to share that technique with you, but we're also going to be talking about the 2 different sleep disruption patterns, what's causing them, and what can we possibly do about it. So stick with me right to the end, because we're going to be dropping a lot of gold nuggets in today's video. This is our 5th video out of 5 in a series on weight reduction for pain reduction. And today we're wrapping up our weight reduction series with an entire segment devoted to sleep. That's right. You might be thinking, sleep? What does that have to do with my weight? Well, when we are constantly waking up in the night or having trouble falling asleep, we're sending a lot of stress hormones, namely cortisol, through our body. And when our cortisol is up, our glucose levels in our bloodstream are up, because cortisol is there to help us run from a saber-toothed tiger or help us maintain our glucose levels through like a fasting period where we might, not have had access to food for a long time back in our more caveman days. When we improve our pain levels, we are able to shed more weight and feel less pain. So let's dive into the mysteries of how we fall asleep, why we sometimes don't, and how come we sometimes fall into patterns of waking up about the same time every single night. So the first thing that we're going to talk about is trouble falling asleep. That pattern where someone lays there and their mind's not really thinking about anything particular, but they just lay there and lay there and lay there, and tick-tock goes the clock and you just can't fall asleep. What's going on there? Most of the time, it's a deficiency of melatonin. Melatonin is our hormone that helps us to actually fall asleep in the first place. So for some people, the simple solution is to take melatonin. Melatonin comes in lots of different forms: sprays, tablets. I really like liposomal melatonin for the best absorption, where you put it like a pump into each of the buccal mucosa before you go to bed at night. But some people can't tolerate melatonin, and they need to take one of the upstream chemicals that then can be turned into melatonin in the body. So the pathway of melatonin starts with a chemical called tryptophan. And tryptophan is then converted into 5-hydroxytryptophan, which is then converted into serotonin, which is then converted into N-acetyl serotonin, which is then able to make melatonin. Pretty good pathway. So some people find that they can fall asleep more easily with tryptophan, which everyone knows is really common in Turkey. And that's why right after you eat a big turkey dinner at Thanksgiving, you want to fall asleep on the couch watching football. Makes perfect sense. So some people benefit from tryptophan, others benefit from taking 5-hydroxytryptophan or 5-HTP, because they are both precursors to serotonin and to melatonin. There's another issue that is at play here that I think is really worth discussing today, and that is, what is the cause? Why are we deficient in melatonin in the first place? Up to 40% of our population actually has a variant in a gene known as MTHFR, methyl tetrahydrofolate reductase. That's a pretty big mouthful. But MTHFR is a gene that encodes for the production of an enzyme that is responsible for methylating our B vitamins, specifically folate and cobalamin, or B12, to make methylfolate and methylcobalamin. Methylating is adding a CH3 group, one methyl unit, to the end of that folate, of that B vitamin. If we can't methylate that B vitamin, then we're not able to make something called BH4, tetrahydrobiopterin, which then is responsible for the synthesis of our tryptophan. So, if we cannot methylate our B vitamins appropriately, we cannot make tryptophan, therefore we cannot make enough serotonin, therefore we may feel kind of depressed, and therefore we also cannot make melatonin and have more trouble falling asleep at night. So for some people, the actual root cause and the key to addressing trouble falling asleep at night involves how do they methylate B vitamins. How do we know if we have a genetic issue? There are genomic panels that we can run that look at all of the different methylation pathways, which is most definitely my preferred route of analyzing our methylation abilities. Or you can go to your doctor and you can ask them to check your MTHFR gene. And just looking at MTHFR is kind of like looking through a keyhole and saying, yeah, we know exactly how to treat you based on this information, right? We're not seeing the whole picture. So if you have any more questions about where to get a methylation analysis from, you're welcome to look it up on the web or hit me up in the comments. I'm happy to share some more information on that issue. The reason this is so important is that if it's an MTHFR issue, that can affect sleep, as well as depression, as well as cardiovascular risk, as well as infertility. So if those issues commonly run in your family, it would be a really good idea to have this genetic testing done. Cool, huh? So the other sleep issue that is really common is that we tend to wake up in the middle of the night with our minds going wide awake, but it's only 1 a.m. or you wake up every night at 2 a.m. or 3 a.m. A lot of people tend to wake up at the exact same time. And that is because their adrenal glands have gone into a pattern of secreting more cortisol, our stress hormone, in the middle of the night. It's common when we've been under too much stress for too long, or that maybe we have some unresolved issue. If you're waking up every night and you're automatically thinking about the exact same thing every night, maybe it's time to spend more time addressing and dealing with this issue head on during your daylight waking hours. Maybe you need some meditation, some prayer, a talk with a family, friend, therapist, pastor, a counselor, someone to help you, work through and resolve the issue that's actually waking you up at night. But what can we do about elevated cortisol levels at night? There's products like Cortisol Manager from Integrative Therapeutics. Cortisol Manager has a proprietary blend of ashwagandha and L-theanine, along with 2 specific herbs, magnolia bark and Epimedium corianum. Both of those herbs have been shown to lower stress and anxiety levels and lower cortisol levels. So it's a great combination to take just before bed. In 2013, the Journal for the International Society of Sports Medicine published a study where they looked at 65 high-performance athletes who were under a lot of stress and had some elevated cortisol levels with a bit of trouble sleeping. And they put all of them on this formula called Relora that had the magnolia bark with philodendron herb in it. And after 4 weeks, they retested their salivary cortisol levels and found that the cortisol levels had decreased and that those athletes reported less depression, less anxiety, better sleep at night, and more alertness and vigor during the day. What's not to love about that, right? And maybe you're someone who has trouble falling asleep and then trouble staying asleep at the same time. It's perfectly okay to actually combine both of those therapeutic routes into the same strategy before you go to bed. But maybe you're someone who has all three issues going on, struggling with falling asleep, struggling with staying asleep, and dealing with pain. Perhaps pain that's even waking you up in the middle of the night. That's when the Pain Eraser program becomes an absolute answer to a prayer. So this is the device that we use inside of our program, and it has two sensors on it. One is sending in waveforms that are parasympathetic shaped in nature, a relaxed, calm state of our nervous system. And the other sensor is reading impedance, or the resistance within the electrical system. And it is altering the shapes of those waveforms every 2 milliseconds to prevent your brain from attenuating to the signal. What's so cool about that is that it works centrally on the central nervous system, and then it works locally on the pain as well. So one of the first techniques that I teach inside of our program is called the 4-minute reset. And the 4-minute reset is as simple as turning the device on and putting it on your forehead, and then hitting that little plus sign until you find a nice happy energy level, and then spending a good 30 seconds just coming across the top of your forehead on one side. And why the forehead, you ask? And why the face in general? Because we have the trigeminal nerve, tri meaning three. There's 3 branches of our trigeminal nerve that basically comes from right back in here. And it is a cranial nerve that goes right into the brainstem. We also have a facial nerve that comes down along the jaw that also goes right into the brainstem. This is our closest way of actually talking right to the brain and giving us that big deep sigh of relief, and putting our central nervous system back into the relaxed state before bed. And so that's it. It's as simple as that. Spending 30 seconds at each of these spots on the cheek area of the trigeminal nerve, and then on the forehead area, and just gently sort of giving your face, it actually can give you a bit of a facelift at the same time. It can improve the texture of the skin, and we can we'll see that wrinkles kind of plump up a little bit, and it's just a lovely, lovely treatment of working through the face. And that's it. Something that feels wonderful, gives you a bit of an uplift on the skin of the face, relaxes the brain, and puts you into a less painful state, and improves your sleep. All with a little device that you get to own and have by your bedside, so that if you wake up and your elbow's in pain, or your shoulder's in pain, or your knee is in pain, or your neck is in pain, you can treat that too. How do you think your life would be different if you were in less pain and sleeping better at night? So if you're interested in learning more about the Pain Eraser program, there's a lot to it, and it's not something that you can just go buy online. There are lots of qualifications. We have to have a call with you, then we go out and get a letter of medical necessity. So there's a lot to being in the Pain Eraser program, and we only take those clients that we absolutely know that we can help. So you have to click on See More in the description below. The description will drop down, and you'll see the link to register for the My Pain Eraser and Rapid Recovery webinar that explains all the details. The web address is https://www.mypaineraser.net. And if you are interested in learning more about our 5-week series on weight reduction for pain reduction, and you want to start at the beginning, make sure that you check out this video next. And if you are interested in finding out more about our device technology and how that works before you dive into our webinar, this is a great video that explains the basics and can get you started in the right direction. As always, we wish you optimal health and happiness, and we thank you so much for watching. I'll see you next time.